We will begin with an address by Mr. Gates. That will be followed by panelists who would each ask a question to Mr. Gates about what he has said. Then we'll have panel discussion. That will be followed by Q&A from the floor. And finally, Mr. Gates will give his concluding remarks. With that, let me introduce our esteemed speaker today. Mr. Bill Gates is co-chair of the Bill and Melinda Gates Foundation. With his wife and co-chair, Mrs. Melinda Gates, he leads the foundation's efforts to help reduce global poverty, eliminate the health problems that disproportionately burden the world's poorest people, and improve the quality of public education in the United States. Mr. Gates began his work in global health philanthropy in 1994. In 1997, he and Mrs. Gates created the Gates Library Foundation to equip public libraries in low-income communities in the United States and Canada with computers and internet access. The Bill and Melinda Gates Foundation was established in the year 2000. Mr. Gates grew up in Seattle with his two sisters. His father, William H. Gates Sr., is also a co-chair of the Gates Foundation and a retired attorney. Mr. Gates's late mother, Mary Gates, was a school teacher at University of Washington Regent for 18 years and the first woman to chair the board of United Way International. It is one of the most prominent charities. After graduating from the Lakeside School, Mr. Gates attended Harvard University. He left college in his junior year to focus on creating the business that would become Microsoft, the worldwide leader in business and personal software. In 2008, Mr. Gates stepped away from his full-time role at Microsoft to spend more time on his work with the foundation. He continued as chairman of Microsoft's board of directors until 2014 and remains a board member and technology advisor today. Mr. Gates is also a member of the board of directors of Berkshire Hathaway. In 2015, Bill and Melinda Gates received the Padma Bhushan, one of India's highest civilian awards, for their work to promote global health and development. Ladies and gentlemen, it's my great pleasure to bring Mr. Gates to you as the speaker today. Thank you. Thank you.
Well, thank you so much for that kind introduction. Prime Minister Modi, members of the Union Council of Ministers, senior government officials, it's a privilege to be with you here today. I was excited when I received the Prime Minister's invitation to deliver the second talk of the Niti Transforming India lecture series. As the Prime Minister remarked when inaugurating these talks, a long administrative tradition has served India well in many ways. He also noted that we live in an age where change is constant. Drawing on the best of India's democratic tradition while embracing these changes is a powerful opportunity for India. Hopefully, the observations I share today can illuminate some of these big shifts and the implications for India, both challenges and opportunities. I don't have a perfect crystal ball, so consider my thoughts for what they are. The observations of an entrepreneur, engineer, business leader, and now a philanthropist. Prime Minister Modi asked me to speak candidly about the challenges India faces and how technology can enable and accelerate India's transformation. Although I've visited India many times over the last 2 decades, there's no doubt I'm very much a novice when it comes to understanding India. India is an exciting and complex place, perhaps even for the people who live here. So my comments are not dictates, but rather advice from a friend who wants the best for India. My very first trip here was for Microsoft. I was amazed at the great engineers I met. And at that time, it started a wonderful success where India became a huge contributor in the IT sector. Today, of course, Microsoft has over 6,500 employees here, and our third CEO, Satya Nadella, was born in India.
I've continued to visit India even as I was making the transition for my full-time work to be with the Gates Foundation. In fact, it gave me an opportunity to visit more and to get to more cities.
Not just Bangalore and Hyderabad, but many other cities as well. And I saw so many great opportunities. I saw a commitment that this government has to tackling inequity. One of the first things that our foundation did in India was a partnership called Avahan with the government on HIV prevention. And that was a very complex program because it involved reaching out to people like sex workers and creating communities and encouraging them to practice safe behavior. There was a lot we learned in that program, and in fact, it was very successful and over time was handed over to the government. That successful collaboration led to many others, some in different states like Bihar and Uttar Pradesh, and many working at the federal level. Most of the work has been focused on maternal and child health, nutrition, sanitation, financial inclusion, and agriculture, all areas where we see big successes emerging from India. Perhaps the program I feel the most proud of, and India should as well, is the elimination of polio from India. Many people thought this would be the most difficult country in the world to get rid of polio, given the size and the number of kids who move around. But in fact, India did a great job, and it hasn't seen polio for quite some time. And that energized the world's polio eradication program. In fact, we're hopeful that the very last cases of polio will be sometime next year. And then after a 3-year period for certification, it can finally be declared as the second disease to be completely eradicated, joining smallpox. India is a huge priority for our foundation. In fact, we do more grants here than anywhere except in the United States itself. Since 2010, we've granted over $1 billion here in India, and that's a number in the years ahead we expect to see continue to grow. Well, let me now focus on the global trends and what I see in the world. I'm very optimistic about India's future, but every country in the world, including India, is subject to these trends. These are powerful shifts. The first is that the global economy is in flux. The assumption that global trade would continue to grow as a percentage of the world economy no longer appears to be true. In fact, global trade has recently declined somewhat. And so to sustain a country-level growth of 7 to 8%, India will have to both increase its share of global exports and take steps to expand its vast internal market, whether it's inefficiencies, land issues, labor issues, tariff and taxes. There's a lot that can be done. It's fantastic that you took the step to change the GST, but that is just the beginning. Another trend is what's going on in energy. You know, we all realize today that both on a local and global basis, hydrocarbon energy can create problems. Now we need to innovate. Either innovate to make improvements in hydrocarbon energy, both in terms of reducing local and global pollution, and to bring in other forms of energy. This is a super important area for innovation. Then we have the trend of climate change. Of course, that's connected to the world's energy system, and it will have big implications for food security. Given that India has 55 to 60% of its crop area rain-fed, the climate change leading to higher rainfall variability is a huge challenge. It really underscores the need to innovate to have more resilient crops and greater productivity, as well as rationalizing water use. Next, we have the changing burden of disease. India, like many developing nations, faces a twin set of epidemics. First, we still have communicable diseases, but already the rise of diabetes and neurological diseases are creating a burden for your health system. We also have possible surprises in the health area, either a naturally caused or an intentionally caused epidemic, or the problem of antimicrobial resistance. In fact, the foundation has been doing surveillance recently and seen that this antimicrobial resistance problem is particularly troubling, and only substantial innovation can avoid that problem. Another trend, which I view very positively, is an increase in philanthropy. Now, philanthropy will never be at the scale of government, and it's no substitute for government. But in many ways, philanthropy and its diversity and its creativity can fund pilot programs and innovation that will create models for the government. I've been meeting with philanthropists all over the world, and I'm encouraged by the trends. More and more people who are very successful are giving their money away, and even people of modest wealth are engaging in philanthropy. On Friday, I'll attend an annual meeting of the India Philanthropy Initiative, where a number of families talk about how to do better at philanthropy, how to encourage each other not only to work together, but to do even more. India has a great tradition of philanthropy through families like the Tatas, the Birlas, the Bajaj. They've been doing great work for a long time. And more recently, people like the Premjis, the Neelankanis, the Piramals, and Karim Mazumdar Shah are also doing very creative work. And so philanthropy plays a very exciting role at funding both new research and pilots in a way that's complementary to the government. The last trend is what's going on in the digital arena. Here we have companies like Google and Microsoft and many academic universities rapidly changing artificial intelligence. Computers today can see and understand language as well as human beings. That's a milestone that we only reached in the last few years. And so as devices using that artificial intelligence get created, it will really change the market. Many of the manufacturing jobs that required fairly low skills will be eliminated by the automation that uses those technologies. And so although there still are great lessons to learn from the industrial models that were used in East and Southeast Asia, this model will have to be updated. It'll have to be a higher value added set of approaches, pulling in the best of India's very strong IT sector. It'll be necessary to embrace artificial intelligence and cloud services, even though they will be somewhat disruptive to the job market. The need for retraining and adaptation as this innovation accelerates will be greater than ever. Well, I think it's important to embrace innovation. It is a little daunting to people that the world is changing at a pace unmatched in human history. In many ways, India will have to shape the innovations in the world and come up with its own innovation because it has very unique circumstances. And I want to talk here about ways that I think India can accelerate the amount of innovation taking place in the country. Countries that have strong innovation ecosystems will be best equipped to address not only their own domestic challenges, but to build the products of the future. Science has given us a lot more tools, and not just in the digital realm. We have things like gene editing that allow us, whether it's in human health, animal health, or plant health, to do really amazing things. We have much better medicines coming out of the deep understandings we have in biology. You know, I'm very hopeful. I certainly expect, and our foundation invests a lot in breakthrough vaccines coming out in the next 5 to 10 years. We're hopeful to have a vaccine for malaria, for tuberculosis, for HIV. And these are huge innovations that will change the healthcare market dramatically. Even in an area like sanitation, we're seeing that new technology can change things for the better. And we can use the digital innovation to change delivery. Often when we think about innovation, it's just the magic new tool, the seed or the vaccine. But in fact, digital innovation allows us to track the delivery throughout the entire system to see, is that healthcare worker showing up? Are they doing a good job? We can call the citizen and see what experience they had. And so we're already starting to see digitally driven supply chains, digital dashboards, a system that track what's going on in education in the best way. And India really is building a great foundation for these kinds of tools to take governance to a much higher level of quality. Well, now let me address the key building blocks for India to drive forward this innovative economy. The first, of course, is the incredible labor force you have. You have a large and growing youth population, with over half the population before under 25 and nearly 2/3 under 35. You have world-class universities, not only the IIT institution, IIM, but also an emerging group of private universities. You have an incredible set of talented people, and not just in the IT sector. We see that across many sectors. We see it in biology and engineering. You have a lot to build on. We see that, you know, in terms of the great businesses that are being built here. You know, this afternoon I got to meet with entrepreneurs working in the health and agriculture sectors, and I was very excited to hear about what they're going to do to improve the quality and productivity in those two areas. Cultivating entrepreneurship is important, and it's been a priority for this country. Prime Minister Modi's Startup India initiative is encouraging entrepreneurs, and we have more venture capital than ever before. And of course, you have the traditional hubs, Bangalore, Hyderabad, Delhi, with a lot going on. But not only those cities, many others are stepping up and creating the kind of environment for new companies. Next, we have what India's done to build a world-class digital foundation. The popularity of the mobile phone, the digital bank accounts that have been created under the PMJDY, flagship financial inclusion scheme, and over 1 billion people enrolled in Aadhaar. Aadhaar is an interesting case. It's something that had never been done by any government before, not even in a rich country, and there were lots of skeptics. Skeptics about the financial viability, the technology, the citizen acceptance, but now you have something that is going to underlie all of your digital systems, whether it's banking, tax payments, tracking healthcare records. It is an incredible asset, and it took a lot of bravery, good government leadership to pull that together. And so when we talk about this JAM platform, that's a real thing, and you're just starting to see what you can do with that in terms of government payments of all types, even being able to track patients and being able to connect the government and the private sector in terms of delivering health interventions, including things like ongoing tuberculosis treatment. The unified payment infrastructure that was launched a few months ago is another key element to make this come together. This shared infrastructure at the core of the payment system really is cutting costs for every provider and encouraging innovation and competition. The Bharat Bill Payment Service will make it easier for people to pay utility bills, and that's just the start of full digitization. In fact, it fits very well with the theme of, okay, let's get as many payments as possible into that digital realm. Another great asset are the companies involved in vaccine manufacturing and pharmaceuticals. Our foundation works closely with the Indian vaccine companies because, thank you, because they are world-class. Serum Institute, Bharat Biotech, and Biological E are providing the majority of all the childhood vaccinations used in the world. And in this entire sector, there's huge opportunity. The world needs breakthroughs to solve these diseases, whether it's drugs or vaccines, and we'll need both of those. We've also seen recently as a world that we have to think about epidemics. Ebola and Zika showed up and we didn't have the right tools. And more infectious pathogen like a form of flu, which is transmitted between humans, would be catastrophic. And so we need to come together and get the technology all over the world to be able to create cures for those epidemic diseases very quickly. And we also need the capacity to make those medicines very rapidly when the problem shows up. A new public-private partnership called the Coalition for Epidemic Preparedness has been put together, and India, through DBT, is the first chair of the board and actively shaping the agenda. So it's great to see India stepping up to help out with what is a problem for all of us, to be ready for even an epidemic that would be worse than the last two that even so have caused lots of challenges. Financial inclusion is a very key platform, and it's interesting that banking has only been used by people who have lots of money. And part of that is that the transaction costs have been high enough that small amounts of money, very small transactions, simply haven't worked. The digital realm is where that can get solved. In fact, there are many problems that the digital realm can solve. If we want to give advice to people on saving, we won't be able to do that by having lots and lots of people. Putting it into digital form, having software that can give you advice, will help people manage their finances in a better way. The bold move to demonetize high-value denominations and replace them with new notes with higher security features is an important step to move away from a shadow economy to an even more transparent economy. And digital transactions really, I think, will rise dramatically here. In fact, I think in the next several years, India will become the most digitized economy, not just by size, but by percentage as well. All of the pieces are now coming together. One piece of this that we enjoyed consulting with the government on making sure it comes together in the right way is the pending rollout of payment banks. This, for the first time, really will mean that you have full currency capability on those digital phones. Once you have that digital infrastructure, the whole way you think about government benefits can be done differently. You know, imagine as an example that when your health system sees the breadwinner in a family become ill, that immediately you understand that you need to make a payment or loan to that family so that they don't miss a meal. Imagine being able to advise a farmer as he's selling his harvest proceeds exactly what he should set aside so that for the next harvest he can buy the best seeds and the fertilizer in order to have high-valued output when the next planting season comes around. Imagine being able to take any excess funds and letting people invest those in mutual funds and other investment products so that individual households can participate in India's growing economy. Imagine being able to have solar units that can be easily turned on and off as you make payments, thus making it easier to extend off-grid solar energy systems into communities no matter where they are. Over time, all of these transactions will create a footprint. And so when you go in for credit, the ability to access your history, that you've paid your utility bills on time, that you've saved up money for your children's education, all of those things in your digital trail, accessed in an appropriate way, will allow the credit market to properly score the risk and therefore loosen up more money for investments, not only in the agriculture sector, but for all the entrepreneurs in the country. Now, this vision of a digital financial platform does require vigilance to make sure that it works well for everyone. We have to make sure that people aren't taking on too much debt. We have to make sure they understand the fees. We have to make sure that our ranking algorithms aren't working in a discriminatory way that doesn't let poor households participate. But all of these things are possible. Once it's in the software realm, once it's transparent, the idea of seeing what's going on, giving appropriate advice to the consumers, all of that will be possible. Well, next, let me talk about education. The digital revolution has not yet changed education, but it will. The idea that young kids can play on a low-cost cell phone, try out their numeric skills, and play games that, even if they don't know it, are helping them with their literacy, that's an exciting vision. The idea that a teacher will have a tablet that will help them know exactly what material they should present, that they can see if their students are doing homework on their cell phones, they can see how well they did with that. We can use their time in a far more effective way. The very best content, the very best lectures in the world can be available to all the students at very low cost. So the idea of educational material being out there on all of these devices is very clear. There are already pioneering efforts like XStep that's trying to build a platform that gets all that material there for very young kids. This is something that not only will there be great work in India, but there'll be a global community trying to bring together educational software. Improving education is kind of a prime boost for the entire economy. And it's kind of stunning how little R&D has been done on education. But finally, by trying out different approaches, some really good software for very young kids all the way up to college students is being created. Software that will do far better than the average lecturer at bringing across the material and helping you out when you're confused. Agriculture, of course, still employs the majority of the Indian workforce. Over the last half-century, India has made amazing progress thanks to the Green Revolution with heroes like M.S. Swaminathan and institutions like the Indian Council of Agricultural Research. But agriculture has big challenges. Growing population, we need to solve malnutrition. As diets shift, we have to have even more output. And as I mentioned earlier, the challenge of climate change. If we stick with the seeds we have today, just a 3 degrees C rise in temperature could cut rice yields by 40%. Wheat would be even worse. And of course, this would be devastating. India would go from being self-sufficient to no longer being self-sufficient. The ability to double farmer income by 22 wouldn't be achievable. Well, the good news is that science, advancing those seeds, changing them, to be more heat resistant, changing them in some cases to have natural biofortification. The kind of research that does that is now available. And a lot of this work can be done by foundations and government through the public agricultural research system. There's a lot of great international scientific partners. One of my favorite examples was what was done with rice. And here, scientists in India adopted the Swarna variety so that instead of dying when it got submerged, it could last for up to 17 days. And that new rice variety, which is called Swarna Sub 1, is now being used by millions of smallholder farmers, especially in eastern India. Well, that's just a glimpse of what can be done. Making crops more resilient, have better nutrition, and having them be far more productive is within reach. We need better breeding systems to do that. And in some cases, we need to look to advances in genetics, which hold great promise. A fairly new technique called gene editing allows scientists to accelerate the trait creation in new plant varieties. And there's already some very interesting things being done with this. How quickly this is done, making sure that it meets the needs of poor farmers, it's all done very carefully. There is work to do there, but the promise is quite incredible. Technology can also help agriculture, not just at the seed level, but also by providing new models of reaching out to farmers and educating them. Explaining to them about the prices or when they should plant, or helping them do multi-cropping when that's the smartest thing for them. These advances in remote sensing and communication can deliver an immense amount of information, whether it's satellites or drones, the ability to recognize exactly what's going on in a field. Does it need more water, more fertilizer? Is there a disease there? What is the likely production? Should an insurance policy pay off for that? Combined with digital land records, this will let us inform farmers even with the smallest plots in a way that never would have been possible before. They'll be receiving on their mobile phone the very best advice. Well, let me talk about sanitation. The government is to be congratulated for taking a topic that's not often mentioned, but is very key. Key for nutrition, for health, key for just quality of life. The government has set very ambitious goals to improve sanitation. The Swachh Bharat mission is off to a very strong start with ambitious goals. We need to make sure that we not only have a quantity of toilets, but the quality out there so that they get use. Our foundation wants to help with this in any way we can. 2 years ago, we hosted a Reinvent the Toilet Fair here in New Delhi. And already prototypes of self-contained toilet systems are being tested here. And these are designs that don't require running water to come in and dirty water to go out. Rather, they effectively burn the waste in a self-contained fashion, avoiding the problems of the smell or cost or things that have been problems with previous innovations. And so there's a lot of innovation that can take place. The cities in India now are being asked to look at their sanitation management and understand how it's being treated. We believe that new machines can take the sanitation and process it in a way that generates electricity and clean distilled water. Finally, the digital revolution can touch on governance. Of course, this is the Digital India mission, where the MyGov citizen engagement platform will help promote active citizen participation. We definitely are just at the beginning of this. The idea of getting rid of paper forms, helping citizens not have to understand all the different departments, helping them not have to fill out the same information. The digital world can do that far better. There will be so many data sets for the government to be able to look at. Some of these geospatial data systems that can be laid down on a map and seeing what's going on with different groups of citizens. And as I mentioned earlier, the feedback from systems about are the government systems working for you, the cost of gathering that data will be far lower. And so every government system will have some type of feedback mechanism that lets you know which groups are doing the best and go over and adopt the best practices of those who get the best score. There's a lot of ways that the government itself can be digitized, the communication between the different departments, setting up a new project. All of the IT vendors are looking at great new forms of digital communication and collaboration where the government should be a really model user of these new ways of getting productivity work done. Well, the innovation potential I've talked about certainly requires investment in people, and it requires an enabling environment. So let me focus here for a little bit on health. Health, of course, is a priority that we've picked on our foundation. And of course, when we look at Indian health, we can see amazing progress over the past years. The childhood death rate was cut more than in half. New resources were put in through the National Rural Health Mission. But still, there's a lot more to be done. You know, every minute, a child dies from causes that are related to malnutrition. Every 2 minutes, a baby dies before even living for an entire day. So we still have a lot to do. We need to focus both on the number of resources and the quality of delivery. We should look at what China and Brazil and other countries did well as they moved towards full middle-income status. It's very important to focus on some key areas: maternal health, vaccination. The public healthcare system has a vital role to play in these very high-impact interventions. It's great to see that not only have new vaccines been introduced, but there is a focus now on coverage. How do we get out to 100% of the kids? As we get the rotavirus vaccine rolled out nationwide, as we get the pneumococcus vaccine adopted and on the same trajectory, we will see diarrheal and pneumonia deaths come down very dramatically. Healthcare is certainly a system where even within India itself, we see a very high variation. And so making that incredibly visible and understanding what are the people doing who are doing this best. How is the staff being monitored in terms of the quality of their care? You know, being there when they need to be there. How are we monitoring the cold chain, the supply chain, and making sure that we're communicating with patients in the best way. Feedback systems where all of this information about the jobs that are filled, the experience people have, all of these will roll up into the government and be visible up to the highest levels. And so there will be a challenge to attract and train people in the best way possible, to make it attractive to them to work in the government health system, including the parts out in the rural areas. So a big challenge there. Let me focus on nutrition. If I had one wish, if I could get rid of any disease, any health problem, I would pick nutrition. Now that's saying a lot because there are other challenges, HIV, malaria, TB, those are incredible problems as well. But malnutrition causes the greatest problem, not only for the kids who die of causes related to malnutrition, but also the kid who survives but never fully develops physically or mentally. You know, India has the largest number of stunted children in the world. And once a kid is stunted, once they get to, say, age 14, there's no chance to go back and get the kind of mental or even physical development that's valuable there. And also, particularly with girls, stunting means that when they are mothers, they're more likely to have premature births, have low birth weight births. And so it's almost a generational problem that if we tackle it now, it will pay dividends for all future generations. So malnutrition can be looked at in any lens. It can be looked at in an economic lens. I was seeing an estimate that said that malnutrition will cost the Indian economy a staggering $46 billion by 2030. I don't think that's the only lens that should be looked at, but it's certainly one that should motivate us all to think about the investments that can be done there. India's done a great job on universal salt iodization, reaching over 90% coverage. And now the government's looking hard at food fortification. Not only having standards, but making these standards mandatory, starting with vitamin A fortification of cooking oil. Although breastfeeding is a cultural norm in India, if we could get mothers to move to the optimal practice of exclusive breastfeeding in the first 6 months of life, that alone would save 170,000 children a year. So we think of that as a nutrition intervention. There's an opportunity to get some efficiencies by taking your commitment to do twice yearly deworming and add to that the vitamin A supplementation. So you're reaching the child through one program, but getting that double benefit. That's something that's been done quite a bit in Africa with great results. Now let me focus on education. I thought the Deputy Prime Minister of Singapore was very eloquent on this. So let me just add a few things that I think complement what you heard from him. I think this is another area where dashboards are very important. And I was very glad to hear that the government is going to charge Niti with coming up with very comprehensive, accurate figures. The ones that I've tend to look at in the past are the annual status of education report, the ACER report, and it does show, again, very high variations. Parts of the country that are doing very well, but overall still some deficits. One I remember is that only 40% of children in class 5 can read at a class 2 level. Only 1 in 5 class 5 children can do simple division. So as you get these figures and make them more accurate, they can be turned into a feedback system to understand how do you train teachers to be the best they can. When we look at educational systems around the world, we see that not enough is invested in helping teachers be very, very good. Teachers need feedback. They need to learn from their best. Again, we can use digital tools to have education training and monitoring and things that are very helpful here. Education really is the key source of inclusive growth and social mobility. It's great to see funding directed to things like teacher professional development, assessment systems, remediation, all things that will improve learning outcomes. Our foundation has done a lot of work on this in the United States, and I can say, of all the work we do, it's been some of the most difficult. But every time I go to a school that's adopted the new practices, it re-energizes me. I can go to the poorest communities in the United States and see what are called charter schools, and the best one of these are doing amazing jobs. So we know for sure that just growing up in poverty does not limit what the child can do if we're able to get them into a great school. A lot of countries have done very well with this, and so that's a challenge and a proof point that it can be done. The teachers and the quality of teachers are a very, very important part of this. But also the kids, just on their cell phone alone, there's a lot they can do to engage and even in early years, get the right exposure. Another key actor, of course, will be the private sector. India's private sector is incredibly dynamic. But when it comes to the boundary between the public sector and the government sector, there's definitely room for innovation. If we just look at the agriculture sector or the health sector, those are great examples of that. The government, as much as possible, should be a policy enabler and regulator so that the private sector is contributing to the public good. Being a smart regulator, allowing innovation, but not allowing the market that's not working for consumers, that is a huge challenge. One of the areas that we've been looking at this is what can be done in healthcare. Can public-private partnerships help build out the infrastructure and staffing effectively and quickly? Can businesses who run very good supply chains, can they help for drugs and vaccines? Can we draw the private sector in to manage insurance-type products so that we get even surprise health expenses paid for through an insurance construct? The availability of care today, simply isn't where we want it to be. Households are paying 71% of their costs almost entirely out of pocket. So over 10 million households fall into poverty due to the cost of drugs and outpatient care. And no doubt, more government resources and a vibrant insurance market, I think, are both necessary to see our way to great health. The last area I'll talk about is this culture of innovation. Again, regulators need to avoid being risk averse, whether it's in medicines or telecommunications products. There's so many new things happening, and the default is often to hold back the new products. Another element where the government plays a role is in basic R&D funding. It was publicly funded research that created most of the great advances that define our age. The internet, the microprocessor, going back earlier, the antibiotics like penicillin. It is the underpinning of the advances that we've made in science. It was actually government research, along with some philanthropic money, that drove the Green Revolution that saved hundreds of millions of people from starvation. It's great to see that Prime Minister Modi has taken steps in supporting increased R&D with a commitment to help 20 autonomous universities attain world-class standards in their research work. This is a big step. I believe that research is something that pays huge dividends and should continue to be a national priority. Often at the basic level, you don't even know what great things might come out of it, but that's why it's called the basic level. In health and life sciences, so many of the things that have been breakthroughs were initially just exploration by scientists. Really, the world is looking to India with the number of minds it has, the capability it has, not only to solve its own problems, but to come up with innovations that help the entire world. So yes, I'm an optimist. I'm an optimist about the world. I'm an optimist about India. A big part of that is because of advances in science. A big part of that is taking technology, including the digital technology, and using it for things that might seem surprising, like using it to make sure the government is always doing a great job. The scale of the challenge here in India is bigger than anywhere. What India is trying to do has never been done before. But it's a government that's very committed to solving these big problems. The talent pool, the building blocks that I talked about, all of this, I think, will lead to an amazing innovation economy. So it's a pivotal moment in India's history. By focusing on the right things, I believe the human condition can improve more here in the next 2 decades than anywhere in the world. And the benefit to India and the world is incalculable. It requires smart investments. It requires leveraging this country's long administrative tradition in bold new ways. By doing this, India will write a new chapter in the history books about how a people and country can rise to big challenges. Mr. Prime Minister, I want to thank you and your colleagues for allowing me the opportunity to share my thoughts here today. It's been a great privilege. I look forward to hearing the thoughts of the distinguished panel and continuing the dialogue during the question and answer session. Yay, hey, merry monkey bot. Thank you.
Thank you, Mr. Gates, for this very fascinating lecture. Take forward ideas proposed by Mr. Gates and critique them. I would now like to invite onto stage our distinguished panelists for the discussion. Firstly, Mr. Natarajan Chandrasekharan, also known as Chandra, is the Chief Executive Officer and Managing Director of